As COVID-19 cases surged in the Philippines on March 2020, stay-at-home orders were put in place. It left many victims of domestic violence trapped with their abuser. Thus, we came up with a title, Experiences of Victim Survivors of Domestic Violence During COVID-19 Pandemic. This research problem will employ qualitative approach. We also have three research questions in line with the proposed problem. What are the associated factors and nature of domestic violence experienced by victim survivors during pandemic? What is the changes perceived by the victim survivors? How does the victim survivors cope with their situation?
So good day everyone. I am Niña Angelica Amamio and these are the discussion on our research topic. It covers several acts of violence which include the physical abuse, the sexual abuse, the psychological abuse, and the economic abuse. It occurs between the parent and a child, the siblings, or even the relatives. It also discusses the factors why the violence happens, such as the unemployment and loss of jobs, lower levels of education, history of exposure to child maltreatment, stress due to physical imprisonment, and also the substance abuse. And also, according to some authors, that the low income, driven by a shift in responsibilities and increased interaction within, may also related to increases in domestic violence.
According to a study of Musara Muhammad Yusuf, domestic violence victims employed five different types of coping mechanisms to lessen their stress caused by their circumstances. And these are fighting in time, positive thinking, seeking formal service assistance, religious approaches, and sharing problems with informal systems. They conducted a study on victims of high risk domestic violence in Malaysia. In this graph, among women in Australia who were subjected to coercive control, physical or sexual violence, or both, 6.8% of the respondents, half of the 51.6%, stated that they have been the victim of both types of abuse. In contrast, isolation was likely to result in physical or sexual abuse. Moreover, 61.1% of the women who reported experiencing forceful control, either sexual or physical abuse. This demonstrates how complicated domestic abuse is, that a large number of respondents had.
In this study, we examined the reasons why domestic violence rates rise as a result of a pandemic. During COVID-19, the government is working on prevention of violence and access to essential services such as health, justice, social services, and coordination of the services to provide support to those who experience violence. We must take action to alert victims of abuse that there is help available. A pandemic within a pandemic. You can recognize survivors of abuse by their courage. When silence is inviting, they step forward and share their truth so others know they aren't alone.